One of our favorite topics. We'll tackle whatever you'd like to know about, medically that is. Ask anything, tonight, on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. I'm Dr. Deb Johnston, one of the Prairie Docs. Tonight, we turn the show over to you, the viewer, and try to answer any medical question you may have on any medical topic. First, let's take a look at this week's Prairie Doc Quiz question. What is more important in making a diagnosis? Number 1, diagnostic imaging. Number 2, laboratory testing. Number 3, physical exam. Or number 4, history taking. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of Dr. Holmes' book, The Picture of Health. Each of his essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. Tonight, it's Ask Anything as we answer your questions about any medical topic as they are called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. And joining us tonight are Dr. Jill Kruse and Dr. Andrew Ellsworth, my partners at the Avera Medical Group Brookings. Thank you for your willingness to tackle any medical question that comes your way. Let's start with a little background from each of you. Jill?
Well, I've been here in Brookings almost 7 years now, and prior to that I practiced in Tyndall, South Dakota for 5 years. Originally from Inwood, Iowa, and did my medical school training down in Des Moines and my residency training with University of Wisconsin rural training program in Baraboo, Wisconsin. So happy to be back in South Dakota.
It's great to have you too. Andrew?
Deb, I've been here 7.5, almost 8 years now, and originally from Madison, South Dakota, and went to undergrad Augustana in Sioux Falls, and then medical school at USD in Vermilion and Sioux Falls, and then residency in family medicine out in Boise, Idaho, and now back in South Dakota again, and loving it.
All Midwestern this weekend tonight, so.
We're the only ones that can stand the cold.
Especially today, oh my gosh. Could definitely do without all
Yeah,
that.
as soon as I said loving it, I was like, it was cold walking over here in my head.
There's a reason I have an indoor job.
Yeah.
I am not cut out for this.
Yeah.
So, well, we hope we get lots of questions from people. We're really eager for it, and we've got one already.
Wow. Great.
Somebody emailed in and said, I have been exposed to C. diff and have 2 children that are type 1 diabetics. How cautious do I need to be so that they don't get it?
You know, the type 1 diabetes, I suppose, could increase their risk, but the number one risk is antibiotic use. And so anytime you're on antibiotics, it's good to be more diligent. Well, and you should always be washing your hands, and especially with a history of C. diff, but also be cautious of using antibiotics. You know, don't pursue antibiotics for that cold or cough or bronchitis or any of these other things that are usually viral anyway. Even mild ear infections often don't require antibiotics. And so that's another way that you could maybe even still avoid them with your children. And then, of course, there's limited evidence to say that maybe probiotics could be helpful. They're still working on that. There's some promising. We can't say. The studies are mixed about what exactly type of bacteria in the probiotics we could recommend, but there seems to be some benefit there. Of course, washing hands and not sharing towels and utensils and cups and silverware, you know, everything else. I guess I don't know for sure if the type 1 diabetes would increase the risk per se, but.
The other thing that I noticed is that the person said that they had been exposed to C. diff. And C. diff is not really something, it can be spread through the community and from person to person, but overwhelmingly, the biggest risk factor is that I've taken an antibiotic myself. So avoid antibiotics when you can. Good hand washing, healthy diet. I feel, this poor family with 2 kids with type 1 diabetics, that's a huge expense. It's a really very difficult situation to be in. And I would think that the biggest concern there would be if that child gets ill, it can make it harder to control their diabetes. So
I might back up and add that C. diff is a bacteria that can be in your GI tract that may take the opportunity to thrive and cause you to be sick and cause you diarrhea sometimes after taking antibiotics.
Yes, because the antibiotics end up killing the good bacteria, and then this bacteria is allowed to kind of take over because there's no one else keeping its population down.
This bacteria is sensitive to very few antibiotics, so we have to treat it in very specific ways. So yeah, that's a very good question.
And I'd also add that this is one of the 2 main reasons why doctors and other providers are being more hesitant than they used to be at giving out antibiotics. Because it might have been used to be you had a cough for a week, now, well, let's see if Z-Pak makes you feel better. Well, maybe 5-10 years ago, yeah, we might have given it a try. Well, now, even after just 1 antibiotic, I've seen people, completely healthy people, get C. diff colitis.
And very ill with it too.
So it's a good reason to try to avoid antibiotics
as much as you possibly can. So a kind of a related question here came in, talking, must be gut day today, some do's and don'ts for irritable bowel syndrome.
You know, keep getting, fiber is a do. It's good to have a high fiber diet. Stress and anxiety can make it worse. So that's a don't. Now, that's easier said than done, but trying to decrease your stress.
Some people have some food sensitivities too with their irritable bowel syndrome. So there's a diet out there that we call the FODMAPs diet. And so there's certain foods that are more likely to aggravate your irritable bowel syndrome. And doesn't happen for everybody, but it happens for some people. So that's an issue. Some people find that they need to minimize the amount of lactose, dairy products, gluten, certain fruits and vegetables. In general, though, fruits and vegetables are good, so it can be a really miserable condition for people. So, and it is a real condition. I often have people tell me when I suggest irritable bowel syndrome, they think that means I'm telling them that it's all in their head. And that's really not the case. It is a functional bowel problem. It is a problem with the way the bowel works, not a problem with the structure of the bowel or the microbiology of the bowel or anything like that.
Right. And there's a lot of things we can do to treat it. So
to help it.
So definitely don't suffer with it.
I'd add that it's a diagnosis of exclusion, and so a person should still have some tests done to rule out other things.
Depending a lot on the situation, you know, if you're a young 20-year-old person with no concerning findings, no blood, no weight loss, no fevers, not waking up in the middle of the night, you don't necessarily need extensive testing, but you shouldn't just assume that's what you've got.
Right.
So, yeah. Good. And we have an emailer who has had pressure in the upper front right quadrant of her head for a year. The MRI and MRA show no tumors. What could be causing it?
Well, I mean, that's pressure, I'm guessing they're saying kind of right up here. I mean, that's a classic place to get migraines, honestly. So I would say if that would be my first go-to. If the MRI and MRI were negative, I would be suspecting that. And I'm guessing if they've had those done, usually if I'm ordering MRIs and MRIs, the next thing is probably talking to a neurologist to see what else they think could be going on.
Head pain can be such a challenging problem. Pain in general can be such a challenging problem, but head pain can particularly be a challenging problem, and it can be from a variety of different sources, and it can be incredibly disabling too. But I would think along those same lines too, migraine, especially if it's something that's not all the time if it's something that tends to come and go.
Yep, and that unilateral headache, that's a classic description for a migraine.
And the fact that it's making them want to go see the doctor for it too. I was reminded at a talk not long ago how, yes, of course, tension headaches or stress headaches and so on are very common, but if it's bad enough they're going to the doctor for it, that makes a migraine a lot more likely.
Yep. A lot of people will misidentify their migraines as sinus headaches because it is classically right there. So that's an important thing to keep in mind if you're having issues with headaches. Okay, we have a healthy 73-year-old who walks every day and their doctor thinks that a blood pressure less than 140/90 is still considered healthy for an elderly individual. Since guidelines change, what are our thoughts on this?
Well, I would say, 140/90 is really when you start seeing the risk of stroke and complications of high blood pressure go up. The guidelines are trying to push things back further and further, but as people get older, we find that their body isn't as responsive with changes, with position changes, going from sitting to standing, lying to sitting. So if we drop blood pressure down almost too low, sometimes we can end up causing more symptoms and orthostasis. So, really our goal to treat blood pressure is to prevent those end problems with it, with the strokes, heart attacks, and vascular things. So, yes, the guidelines are saying lower is better, but I would say still 140/90 is kind of where we see that really being a concern. And there is a risk of overtreating in the elderly. So I would say, being cognizant of that. So yes, the guidelines are changing and we're trying to pull back lower for younger people, but I don't think we need to go crazy.
As we get older, our vessels lose some of their elasticity, some of their compliance, and so the blood pressure can shoot up higher easier and doesn't relax as well either. And so thus it gets harder to keep that blood pressure up sometimes from, like you said, sitting to standing, and you stand up and the blood pressure can drop. Well, if the blood pressure drops and it makes you feel faint or pass out and you're elderly, now you have a better risk of breaking a hip or something. And so the risks, like you said, go up the more aggressive we are with blood pressure management as people are older. But there's also the risk of heart attack or stroke too. So those guidelines, some of them said, we should get everyone less than 120/80 now, or whatever else. And we're all here because we're all in the real world here, and we're mostly shooting for less than 140/90 for the most part, I think, because we don't want to cause problems either with aggressive blood pressure management. And some of those guidelines weren't looking at people over 80, 85 years old either.
And I think you have to look at the whole picture as well, because I think we all have patients that are in their early to mid 70s that are very active, they're athletes, they're on the go, and then we have patients that are 70 who are less healthy than some of our 85-year-old patients that have multiple medical comorbidities and are just very frail. And so it really has to be kind of an individual goal. And one of the truths in medicine is that our targets are always moving. Look at our cholesterol targets and our blood sugar targets and everything else. And we learn more, we do better, but you still have to put it in the real world.
With that said, though, blood pressure management is one of the best things things we can do to help decrease a person's risk of a stroke or heart attack above and beyond their blood.
Smoking.
Other than quitting smoking, above and beyond their blood sugars and everything else. So.
We have a caller who says that their right calf continues to cramp. What suggestions might we have?
I would say, when is it cramping? Is it cramping at night? Is it cramping with exercise? Is it cramping with being in one position too long? So Without more information, it'd be hard to answer that. I mean, I'm assuming they're talking more about kind of the night restless leg sort of cramping. I mean, it's possible. Usually that's bilateral, but it could be just one leg. It's hard to say.
The first thing I would think of is if this person might have some poor circulation and be having unilateral leg cramps because they have that poor circulation in that leg. So that would be something that to get in and get checked out.
Varicose veins. I mean, there could be many
there
things.
could be many things.
And the worst case scenario that we want to never miss would be a blood clot in a leg.
Yeah, that's a very good point as well.
Especially if it's just one leg and not the other.
Yep.
Sometimes it can mean they just need to drink more water. Sometimes or a multivitamin or potassium or something like that could help.
Go in and get it checked out.
Yeah.
Exactly.
Whether it's an ingrown toenail or a corn, aching feet can really impact your overall health and mood. Sometimes it takes a foot care specialist to relieve the discomfort.
When you come in the door, actually, that's when our assessment starts. We look at how you walk, if you use canes, crutches, wheelchairs, walk with a steady gait. After we get started, I make an examination of the foot and I check the pulses, I look for the color, circulation, watch the calluses, corns, pay attention to them, your toenails, and we also document all that. And I can use this to debride calluses, corns, and any hard, thick nails, I can take them down. If you're complaining about some certain thing going on with your feet, we do make recommendations, or maybe you could use something like offloading on a corn, callus, and I've got these different things I can help with. If I see something that the podiatrist needs to see, like just the other day I seen a man, he thought I could fix his ingrown toenail, and I said no, but I can call over and make you an appointment and tell you where to go for that. Open sores, fissures like cracks in the heels, huge calluses, purulent drainage around toenails, that's going to be an infection probably. Not only diabetics, but we see people who have poor eyesight, or maybe they've gotten a little larger around the middle and can't reach over and do their nails like they used to do. We see people who have, even younger people come in because they've got thick nails, and they might come in once every 6 months, get those tweaked up really good so the feet look good. Neuropathy in their feet and not good sensation, and they don't always know when they have an ulcer on the bottom of their foot. I know of people who have had actually amputations because they stuck a needle into their foot and did not know about it. Or even at home, doing your own visualization, putting a mirror on the floor and looking at your feet, or having a friend, a spouse, look at your feet. A person really needs to do that if they've got loss of sensation. If your feet do not feel good, you do not feel good all over. And if your feet aren't feeling good, or you're having poor shoes, or wearing poor shoes, or poor fitting shoes, or worn out shoes, that can affect your back, your hips, your legs, everything.
This is your program, and your questions are key to the direction of our discussion. Call in your questions to 1-888-376-6225 or send us an email to ask@prairiedoc.org. Keep those questions coming, people. We have a question here about hemorrhoidal issues and a visual fissure. I assume they mean an anal fissure. What are recommended treatments besides changing diet that would be helpful?
So an anal fissure is when there's a crack in the anus, and then basically sometimes every time you poop, it re-stretches that and sometimes re-tears, and a lot of times patients will complain like they feel like they're pooping glass, because those can be
excruciatingly
painful, and then they can bleed too and drip some blood. Those can be hard to treat. It's important to get your stool softer. That way you're not, pooping out a big piece. I hope everyone wanted to. Could I say poop on the air? and
We've
defecate.
said it a lot tonight.
I'll say defecate. And then I have prescribed some creams before that can help to improve the blood flow to that area to help improve the healing. Now, sometimes they'll even do surgery and such, but usually we don't have to resort to that. As far as fissures go, I don't know if you want to talk about hemorrhoids.
Hemorrhoid, sitz baths it's an old-fashioned remedy, but it works well. So just kind of getting that area calmed down. Yes, increasing your fiber intake. Fiber kind of acts like a sponge. It just draws more water into the stools, keeps them soft. It's good for diarrhea because it soaks up extra fluid. It's good for constipation because it, again, makes the stool softer. I would definitely say, it's they can be frustrating, and there's a lot of over-the-counter topical things. Sometimes I find that the more you leave them alone, the better they get on their own, because at least from personal experience with pregnancies, the more I messed with them, the worse it got. And when I finally just gave up and did nothing, it started to get better. So sometimes the more you're touching these areas or putting creams and ointments and Tux pads and all that stuff, sometimes you can actually end up irritating it more. So a little treatment goes a long way, and then just try to leave that area alone and let it heal.
Hemorrhoids don't necessarily need to be treated.
Right.
And a lot of itching isn't so much from the hemorrhoid as it is from difficulty with hygiene around that bumpy hemorrhoid. So keeping the stool soft. Hemorrhoids are a varicose vein around the anus. So the more you have to push, the more difficult the situation will become. Pregnancy is a classic example because you have that big old baby sitting right on that big vessel and causing that varicose vein to get worse. Pushing to push that baby out tends to be a terrible situation for hemorrhoids. Keeping those stools soft so you don't have to push as much. They can be treated surgically. It's kind of a nasty experience. There are creams that can be helpful for those fissures to help with the pain and hopefully let them heal on their own.
Prevention involves, like we said, keeping the stool soft and avoid straining and avoid sitting on the toilet for very long. It's tempting maybe to sit there and read, maybe it's the only chance to get away or something, but that adds more pressure and can increase your risk of hemorrhoids, so get on and get off. The only other thing I want to add is don't assume that it's a hemorrhoid. There's been definitely more than one occasion where a patient thought they were having hemorrhoid issues and there was something else going on, whether it was cancer or something else. So especially if you have blood in your stool or anything like that, come in and get seen.
And I think that's a good segue into the next question, which is about treatment for lichen sclerosis, which is one of those things that people can assume, oh, it's my hemorrhoid causing this problem, but it can actually be this skin disorder. So Jill, you want to talk about it? I bet a lot of people don't know what lichen sclerosis is, so that would be a good thing.
Yes, so lichen sclerosis is this change in the skin where it gets kind of this very red, itchy, that sometimes we'll get this thick white scale on it. And the places where I've seen it the most is generally in the vaginal or labial areas, and it can be very itchy, very painful. Not an area you can examine easily on yourself, and usually not an area that anyone wants to ask anyone else to look at. So, and something easily missed if you're not having your annual exam and not getting completely undressed for your doctor and letting them look at this area. So it is something that we do have to worry about, because if untreated, it can sometimes lead to skin cancer in that area, put you at a higher risk for that. So we do need to treat it, and usually we treat it with a steroid cream that will help kind of clean up that area and get rid of that scale and get rid of that redness and irritation. So very common, more common than I think most people realize, because it is something that's generally not talked about much.
This caller has had low back pain for a long time. Getting up and moving helps the pain, which is great to hear. What are possible ideas to eliminate the pain completely, or at least reduce it?
As far as eliminating pain completely, it just, that reminds me of narcotic pain pills. And sometimes that's a endless battle that you can't win, unfortunately, sometimes with back pain. But like you said, being active and finding things that help, and whether that's physical therapy, and exercise or swimming or acupuncture or reading and journaling or finding something to refocus towards something else can be more helpful.
I'm a huge fan of physical therapy. I think physical therapy with a lot of orthopedic issues and other issues is just hugely underutilized. Everybody should get physical therapy every year, as far as I'm concerned. But another option, there's TENS units, which are kind of like electrical stimulation things that can be helpful. If you've done these things and it's not been useful, it might be worth seeing a physical medicine and rehabilitation doctor to make sure that we're focusing on the right rehabilitation issues. And if getting up and moving helps this pain, I suspect this person has pretty good prognosis for getting relief with the right kind of rehab. So.
Yeah.
And a similar question about neck pain caused by arthritis. What are this person's options?
Well, I would say kind of some of the similar ones. You have a lot of the over-the-counter anti-inflammatories, the NSAIDs. You have to be careful with those not to use them too long or not, take them without food because it can be somewhat hard on the stomach. Topical therapies, I'm a big fan of warm, moist heat to help with pain, or like the topical lidocaine patches, the Aspercreme rubs. Any of those seem to really help benefit, and it's topical, so you're treating locally right where the issues are. Massage, again, acupuncture, physical therapy, I've seen all of those help. TENS units are great. And the real fact is there's a lot of modalities, so keep trying until you find one that works, or a combination of them that work. So it may not be one magic thing that fixes it, but things in concert that will help keep you. And basically, what is the functionality? If we can keep you active and doing what you want to do, that's great. With arthritis, can we take all the pain away? Sometimes yes, sometimes no. But if we can keep you active, that's really what our end goal is.
The other thing that I'd like to add is Tylenol. We didn't mention that specifically. Tylenol is safe at the doses on the bottle for the vast majority of people. We do have to be a little careful with those NSAIDs because people with chronic kidney disease, for example, they may be something we have to be very careful with.
I might add, we didn't mention surgery. Surgery can be helpful, but it has a poor track record in back pain and neck pain, and a lot of times it's 50-50 or worse, whether it's helpful. And in 5 years, usually you're going to be about the same, whether it's good or bad, whether you've had surgery.
You have to be very careful who goes to surgery. It's people are often tempted to, I just need to go see a surgeon and get this fixed. Yeah. And sadly, it only is helpful in very select people. So that's something to keep in mind. If you break the eardrum in one ear, why does the other ear hurt, and how long until it gets better?
I guess I hadn't heard that before.
So sometimes a ruptured eardrum actually relieves the pressure. And so whereas the other side might still have some pressure backed up, so that might be why it still hurts in the other ear. So you've got your eustachian tube between your nose and your ear. And whether you're congested or whatever else, that can plug up. And then, for a lot of, especially infants and little kids, fluid gets in there, gets infected. There's a lot of pressure, or other people if they and it can get infected. And sometimes then it ruptures and drains, and sometimes then it feels better that when we put tubes in, we're creating a space for that to drain out of, so that pressure doesn't build up. So I guess I think I would say
that would be my best guess too about what's going on with this. So hopefully when the underlying problem gets better, this will get better. Usually it's in the context of a respiratory infection that this happens, so hopefully soon for this poor person.
If it's been an ongoing thing, there could be an allergic component, and maybe they'd want to use like an over-the-counter steroid nasal spray or something to help relieve the pressure.
Decongestant if they don't have blood pressure issues or those kinds of things. This is an interesting one. Can you be allergy tested to see if food could possibly be causing depression or anxiety? Can food intolerance affect your mood? We're all.
You know, I don't know how much that's been studied.
Yeah.
You know, it is amazing, of course, the way food impacts us, of course, and caffeine and people, you know, when they've gotten rid of processed foods, I know of a lot of people have felt a lot better, and there must have been something in there they didn't like. And sometimes and if you feel better, your mood is going to be better. So
I think too that, you know, a healthy lifestyle, eating right, getting your fruits and vegetables, getting enough sleep, getting your exercise, those are some basic things that can be helpful for everybody. And for people who have mood issues, that can be an important part of their treatment. It's probably not all. This is actually a good question to think of for next week too, because there's going to be a depression and anxiety show. So it may be something that the psychiatrists have a little more information on than we do. Food testing for allergies, do either of you want to kind of touch on that? That's always such a fraught topic in my practice.
Yes, I generally tend to leave that to the allergist. There's two different ways of doing the skin testing and then the blood testing. The skin testing that the allergist can do is much more accurate and much more beneficial than the blood testing that you can get from lots of different places. So from my conversation with Dr. Bubak, he's like, if you're going to test for allergies, let me do it with the skin antigens, and that's you're going to get the best results to know if this is a legitimate allergy or not.
And it's also important to recognize that there's different pathways allergies can take, and food allergies often present through a different pathway, and it's actually pretty difficult to test for food allergies, except for the whole, you know, peanut, I stop breathing kind of thing. Those severe allergies are a little bit different.
and there's some of the food sensitivities that might
That
not
are
show
very-
up on an allergy
testing.
test. So.
A recent outbreak of measles prompted a state of emergency on the Pacific island of Samoa. 2/3 of the population didn't receive the measles vaccine, resulting in 5,000 cases and more than 70 deaths. The importance and safety of vaccinations can't be stressed enough.
So since the measles vaccine came out, there's been way over a 95% reduction in cases and in deaths. It is one of the routine childhood vaccines. It's given in a 2-dose series when children starting at 1 year of age. We don't usually give it earlier because the mother, being immune to measles, will pass antibodies to her child, and they'll last for several weeks. So if we give the vaccine, sometimes that vaccine and the maternal antibodies can make it so that the vaccine's not as effective. So we start this vaccine a little bit later in life. The people get 2 doses, and that causes lifelong immunity to measles for about 95 to 97% of people. There was a big push for the measles vaccine, especially after the polio vaccine had come out and had been successful. So there were many attempts to make a measles vaccine that would be as effective as the polio vaccine, and it was quite a race. In fact, there was a man named Dr. Anton Schwartz who was part of that race. He had worked for the people who made polio vaccine, and many of the strains used today are the Schwartz vaccine strain, and he ended up life in South Dakota. So we have a South Dakota tie to the measles vaccine. It has very few side effects. It's a live virus, but it is not the measles full-strength virus or anything like that. It's what we call attenuated, meaning it doesn't cause disease anymore. The island of Samoa has the same population roughly as the city of Sioux Falls, and they have had they had 5,000 diagnosed cases, 72 deaths, mostly in babies and children, and I just couldn't even imagine 72 children in Sioux Falls dying, for example, in that population. The most important thing is that this is a preventable disease. If you get it, we still don't have any treatment. To this day, we have no actual therapy we can give you. We can, give you fluids and rest in bed, but then the disease really is going to take its natural course. So prevention is the key, and vaccination is the key. So all children should be vaccinated. If for any reason an adult is not yet vaccinated, they should be vaccinated. This is a safe vaccine. This is a vaccine that we've been given for decades and decades and decades. It's a completely safe vaccine.
right. You know, one of the things that really struck me about that was the mortality rate from that measles. I mean, 70 out of 5,000, that's between a 1 and 2% case mortality rate, and that's what we're getting reports of out of China. So, you know, we have a vaccine for measles, and everybody should be getting that vaccine.
That's why everyone lined up to get it as soon as they could when it came out.
Yeah, exactly. When back in the day,
Back then, everyone knew
how
what they were up against and wanted to do everything they could to prevent
it. How can the recurrence of small intestine bacterial overgrowth be prevented? I'm assuming this is somebody who had some issues with that, probably similar to the C. diff, and we do sometimes see kind of bacterial imbalances, particularly in people who have chronic illnesses. And I think this comes down in large part back to the same things we were talking about with the healthy. I hear people talking about the prebiotics, which really is just a healthy diet to feed the good bacteria in your gut, as opposed to the highly processed foods that that most of us tend to like.
Yes.
Yeah.
All right. A caller seems to have an allergic reaction of the skin that started on the leg and went onto the back and face. They live by a radio tower and are wondering if it could be the radio waves that are causing this reaction.
I would say no at this point. I mean, radio waves are going out from all directions at all times. We're all exposed to them.
Hard
to do that. There are certain physical things that can cause allergic reactions. We will see cold urticaria is probably the most classic description, but I have never heard of radio waves causing this problem.
No.
Hives can be such a frustrating thing to identify sometimes, so I feel for this person. But
yeah. I mean, I've heard of migraines and headache things being associated with like high voltage power lines, and but not.
Even viruses sometimes cause hives.
It's probably the most common cause, so at least of acute hives. Oh, here's a GI question again for us. What can be done for rectal prolapse?
Talk to your surgeon. If it's gotten to the point where the rectum is where it doesn't belong, coming out,
and prolapse means.
You need someone to help tuck it back up where it belongs. And I don't think any amount of cream is going to get you the results you are desiring.
One patient with rectal prolapse, the surgeon had me put sugar on it because that helped draw out some of the moisture with the idea then it might be easier to reduce and push back in.
But it's not a long-term solution.
No.
It's a right now emergency solution. I think here's a good related question. Is it normal for a 65-year-old woman to leak urine when coughing a lot or lifting a heavy item? How do you know when to consult a doctor?
Anyone who's had a baby, I think, will relate to that.
And even people without babies.
And babies not, yes.
And I think the answer, how do you know when to consult the doctor? The answer is now.
When it's impacting you. I mean, it sounds like it's bothering this person, so why not?
Yeah. And there are things that we can do.
I mean, we have an amazing pelvic floor rehab physical therapy program
here in Brookings, and this is available in lots of different places, and can really alleviate the need for surgery for a lot of people.
Right.
So there are a lot of treatments. From topical medications, estrogen can help sometimes, physical therapy, pessaries, and surgery.
Yeah, with that physical therapy comes down to sometimes the Kegel exercises. But how do you know if you're doing it right? Well, the physical therapist can help you train those muscles you need to help strengthen that pelvic floor sometimes.
Can anything be done for neuropathy besides taking medication?
Getting your blood sugars under control can be helpful. I've seen it where diabetics patients with diabetes were having more problems with neuropathy or more pain, and once they got their diabetes better controlled, their neuropathy improved. Now, oftentimes, once it's there, sometimes it's there, but it,
it can be a frustrating problem, but keep working with your doctor. What could cause vaginal itching along the hairline?
Well, there could be ingrown hairs in this area, there could be yeast infection, there could be lichen sclerosis, there could
Skin
be
conditions?
dermatitis, there could be all sorts of things in that area.
Somebody needs to look.
Somebody needs to
That's
look.
the bottom line with that. What treatments are recommended for imbalance in the inner ear?
So there would be what's called the Epley maneuvers or the Dix-Hallpike maneuvers. Those are the two probably most common ones that can be done by physical therapy.
Some ENT doctors.
ENT doctors. I was trained a long time ago, but haven't done them since residency.
There are some maneuvers basically that can
that.
help with that, and sometimes medications can be helpful. So, a healthy and active diabetic is not able to get the hemoglobin A1C below an 8. Any recommendations for this?
So, with diabetes control, for a long time we wanted to try to get everyone less than an A1C less than 7. And what is an A1C? It's a blood test that helps show us the average blood sugars over the last 3 months, because it's a red blood cell, and the more sugars that surrounds it makes this number go up. Of course, diet and exercise are paramount and can make a huge difference. Sounds like this person has been healthy and active and still having problems. Obviously, there's all sorts of medications now that can be helpful. It's a balance of so many things, and that's where a visit with your doctor to come up with a plan can be very helpful.
Yes, well,
But sometimes what I was going with that too is that sometimes we don't need to get it less than 7 anymore. Even 8 is depending on the situation. So,
With age-related macular degeneration, after treatments, can you be completely cured? Can it be caused by rubbing itchy eyes?
I would have to ask an ophthalmologist on that one. I honestly don't know. Caused by rubbing and itching the eyes, no. I can say that much, but
I don't think this can be completely cured.
Not that I'm aware
It's
of.
a very difficult disease.
it sounds like total screen time can perhaps be a factor, the blue light thing from screens, but it also runs in families and just is common with aging too. So.
For a couple of months, an emailer has had some pain, mostly pressure under their rib cage at the bottom. The last 2 weeks, they've had a dry cough at times throughout the day with some pressure in the chest and upper back off and on. Should they visit a doctor?
2 weeks, if
Yeah.
you're concerned enough to ask us, ask your doctor.
You
yes.
need to go in and get that checked out. There's no question about that. An emailer had a blood draw earlier this week. When the needle was inserted, they had a sharp stinging pain down toward their wrist. The phlebotomist in training took the needle out quickly and said she may have hit a tendon. 2 days later, their arm almost hurts more. Should they be concerned about nerve damage? How should they treat this?
Well, it sounds like they did get, if you're getting a sharp shooting pain when it happened, I would say yes, either got close to a tendon or close to a nerve. Unfortunately, what's happened is, you can't undo that, but I would say trying to bring down inflammation and swelling is going to be our goal here to get the pain to go away.
Warm packs, and unfortunately the nerves like to run with the blood vessels,
Right.
and they're very easy to poke there.
Usually time will be their friend there.
Yeah, time usually takes care of this issue. So
Yep.
warm packs and
When
patience.
the swelling goes down from the injury, the pain should improve.
Is there a cure for sciatica? I'm told I'm not a candidate for surgery and physical therapy is not helping with pain.
Well, I would say sciatic, because usually when the sciatic nerve is getting pinched somewhere in the body, usually in the buttocks, it splits the muscle called the piriformis muscle in half. So it's the largest nerve in the body. It's about as big around as your thumb. So it doesn't take much for that muscle to get pinched by something because it's so big. So stretching exercises is usually what we do. Sometimes I've done some steroid injections to help with that if physical therapy isn't helping. I've talked with surgeons about other options. And
This would be a really good role for those physical medicine and
rehab
rehabilitation
doctors.
doctors.
Yep.
Can anything be done for tinnitus
Or tinnitus.
or tinnitus?
Potato, potato.
Yeah.
Yeah, I call it tinnitus too.
Tinnitus. It gets pronounced more than one
the
way.
ringing in the ears.
Yes.
The number one cause that could be helpful for it is if they may have some hearing loss and get their hearing tested and get a hearing aid, might actually take care of it. That'd be the number one thing. There can be other causes, so it is something to get looked into.
I like to recommend masking noises.
Yeah.
So you get you find a fan or something that hits that pitch, and a lot of times your brain learns to ignore it.
Yes. I actually learned an interesting little trick for this, because I also have a touch of tinnitus or tinnitus, however you want to say. And what works is if you cover your ears like you've got earmuffs on, and you put your fingers and you're pushing them like you're snapping. So like here, and you snap and you're snapping right on the base of your head. Do that about 40, 50 times, and just that hitting there, that pressure. And for me, it like goes down to almost like a 0.5 or completely goes away for a while. Now it's not permanent, but if I'm having a hard time at night sleeping, I do that. It knocks it down enough that I can get to sleep. It may come back later in the day or the next morning, but
gives you some relief.
It was an amazing trick that I ran into on a female physician Facebook group of people talking about what can we do about it because it's so frustrating.
An emailer asks, what are the symptoms of a kidney infection?
That'll often stem from having a urinary tract infection. It gets up in the kidney. You might have pain on your side there, and or pain with urination or fever, and come in and get it tested, get a urine test at least.
What would some dietary guidelines be for someone who is morbidly obese?
That is a 1 hour long conversation with a dietitian. So we would be doing you a grave injustice if we tried to do it here in the last minutes of the show.
But briefly, more fruits, more vegetables, more high fiber, less processed food, and work with your doctor to go get in to see the dietitian and get a customized program for you.
And exercise and activity.
Exercise and activity, yep, that is critical important
and
too.
try not to worry about the weight so much as being healthy.
Being fit, yep. I think we have time for one last question. A caller's lower leg veins are 100% occluded. Is a stent possible or only a bypass?
If it's 100% occluded, you need some opening for the stent to get through. So if it's completely blocked, they can't get the probe through to open it. So I would say at that point, bypass.
You're going to have to talk to the surgeon. So.
Yeah.
And now for the winner of tonight's Prairie Doc Quiz question. What is more important in making a diagnosis? Number 1, diagnostic imaging. Number 2, laboratory testing. Number 3, physical exam. Or number 4, history taking. And the answer is number 4, history taking. It was Kay Walsh from Custer, South Dakota, who answered the question correctly. Thank you, Kay, for participating, and a book will be in the mail to you soon. We'll be right back after this.
For nearly 2 decades, the Prairie Doc organization has endeavored to enhance health and diminish suffering by providing useful information based on honest science in a respectful and compassionate manner. Health professionals volunteer to answer your questions each week, creating a vast Prairie Doc library of medical information available to you and your family 24 hours a day. Make sure you don't miss a thing. Follow the Prairie Doc on Facebook and YouTube for free and easy access to the entire Prairie Doc library.
We primary care doctors do many different things. We diagnose illnesses from the trivial to the catastrophic. We treat maladies both chronic and acute. We confront and we console. Of course, these are common roles in medicine filled by many different providers. One role the primary care physician is more uniquely suited to fill, and one of my personal favorites, is that of guide. I'm talking specifically about the art of prevention, of maintaining wellness over the long term and reducing the risk of diseases that might make it harder to do what you need to do, what you want to do, and what you love to do. Prevention is truly underutilized. We're a lot better at looking for a problem and a pill or a procedure to fix it than we are at fixing what might lead to a problem in the first place. In fairness, human beings are inclined to wait for the crisis to hit before we believe it is really and truly ahead. Changing habits is hard, and eating takeout pizza while watching must-see TV is a lot less work than hitting the gym and making a salad. On the other hand, some parts of prevention are easy. It's easy to get a flu shot or a shingle shot. It's easy to get a mammogram or a colonoscopy. It's easy to get blood drawn and get checked for diabetes or hepatitis C. Of course, it's only easy to do these things if you're aware of the benefits of doing so. This is the value of the annual checkup. From birth to your last birthday, wellness visits have an important role. For infants and children, we monitor growth and development. For adults, we screen for diseases and give advice on reducing risk factors that might lead to disease. Even the oldest of our old can benefit from simple tests for things such as hearing and memory. And at every age, we think about safety. Is that infant sleeping on her back? Is that teen wearing his seatbelt? Is that adult drinking and driving? Is that elderly person at risk for falls? And of course, has that patient had their flu shot? Under the Affordable Care Act, most insurance programs cover prevention visits with no copay. This even includes Medicare. Everyone can benefit from these opportunities to focus on staying well rather than treating problems. Prevention is an important part of being a primary care doctor and an important reason to have a primary care doctor. So take your preventative action today. Make a call and set up an appointment just for that checkup. A big thank you to our guests, Jill and Andrew, for volunteering to come to our studio in Yeager Hall on the campus of South Dakota State University and add their experience and knowledge to our program tonight. If you would like more information about Prairie Doc or to see more episodes, please like and follow us on Facebook or visit us at prairiedoc.org. That does it for us tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
We live in a busy, noisy, and pressure-laden world. Being able to deal with that environment is not easy. Coping with stress, anxiety, and depression. Next time, On Call with the Prairie Doc.
Hello to all. I am Dr. Tom Luzier, a practicing allergist in Aberdeen, South Dakota. Born in Kansas, I embraced the diversity of South Dakota. This diversity comes with a price: limited healthcare resources and information. The Healing Words Foundation, through Prairie Doc, provides an open, online, interactive, public broadcasting format for reliable health information. As a member of the Healing Words Foundation Board, I am asking you please to join me in support of this work, which is funded entirely by donations from you. Please consider making a personal or corporate gift to Healing Words Foundation, a 501c3. Go to prairiedoc.org and click on the donate button and make a valuable contribution. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
with the ongoing support of these individuals and institutions: South Dakota Foundation for Medical Care, Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, American Academy of Family Physicians Foundation and South Dakota Academy of Family Physicians, Black Hills Medical Society, Aberdeen District Medical Society, Flandreau Madison Brookings District Medical Society, Sioux Falls District Medical Society, Yankton District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Aberdeen Asthma and Allergy, and Swift Telecommunications.